If somebody also, aren't there some of the OTCs that if people take a lot of them regularly, they can do damage to other parts of your body?
And by OTCs, you mean over-the-counter medications?
Right.
Most definitely. Most people, before they come to medical care for a painful issue, will do everything they can do to manage their pain on their own. They'll be taking aspirin, ibuprofen or Advil, as it's branded to be known as, or Tylenol, or any number of over-the-counter combinations, oftentimes multiple at the same time. And yes, you can develop stomach ulceration, you can develop kidney disease, you can develop liver failure. All of these things are sometimes developed and irreversible before people realize it. So yes, it's very important to not go beyond what the label on your over-the-counter medicine tells you is safe to take when you're trying to manage this kind of thing.
Quite critical. Over 16,000, or I said that wrong, 60,000 people a year get compromised by anti-inflammatory pills. 16,000 die from bleeding ulcers and other bleeding complications from these medicines. All medicines, even Tylenol and Advil, have potential complications. So if you find yourself having to eat a bunch of them, particularly Goody's powder or some of those poorly regulated raw aspirin formulations, you're at risk. It's better to seek more definitive management for your pain.
I'm constantly counseling people to recognize that just because it doesn't say Tylenol on the label doesn't mean there's not Tylenol in the product. Acetaminophen is the generic name for Tylenol, and just because it doesn't say Advil on the label, it doesn't mean there's not Advil in the product. Ibuprofen is the generic there. So you have to be really careful when you take medicines for pain over the counter to read what's in it. Just because there's 3 different names doesn't mean they don't have the same ingredients.
And you're right, but it's not even pain medicines. Alka-Seltzer, which is not designed to treat pain at all, has aspirin in it for some crazy reason. And so if you have a bleeding ulcer disease, who would think to read the small print on Alka-Seltzer, something we take for granted, but it can aggravate a bleeding ulcer or cause one if you're on the edge of it.
Cold medicines often have either ibuprofen, aspirin, or Tylenol in it. Sleep aids will sometimes have it. Tylenol PM. You think of it as a sleep aid, but it's Tylenol with...
You could clearly overdose on Tylenol.